So thank you, thank you. We are from West Bergen Mental Health Care, West Bergen, headquartered in Ridgewood, now actually celebrating our 60th year in Ridgewood. This entire year is actually our celebratory year. So continue to look out for all kinds of celebrations for that. And know that the partnership between West Bergen Mental Health Care and Valley Health System goes back really quite a long way. Although I'm going to say in the last couple of years, particularly around COVID, boy, we have become close. And so not a surprise given the need for mental health that's out there and the need to, in many ways, I think from a kind of a macro perspective, an acknowledgement. I'm going to take it to the next level, a celebration in some ways, that mental health and physical health absolutely sit together. I think in days gone by, we thought of ourselves as different or other or separate. And I think everyone universally agrees, thank God, by the way, that everyone now universally agrees that we are one family, one together group, and that the left hand and the right hand so integrate with each other. And so thank you for the partnership. Thank you for being here today. We are really happy that you've joined us today as well. And again, I think about sort of mental health overall, and I think about stigma, and I think about many of the things that have gone on over the decades, and not just with the 6 decades that West Bergen's been around, but very, very much the entire mental health community. It wasn't that long ago that this kind of talk would have never been scheduled, right? Sue would have never called us from Valley. It would have never been something that would have been of interest to the community. And so the very fact that we are here, the very fact that you are here, tuning in, wanting to be knowledgeable, wanting to get more information, absolutely tells us that that mental health in some ways has been recognized and is here, and that we are here to stay in many ways is the way I kind of think about it. So with regard to today's topic and thinking about trauma and mental health overall, just a couple of thoughts, and our outline today is going to be, I'm going to share some thoughts, really just very high level points for us to reflect on and think about. And we've designed this talk very much with you in mind. So this is a talk that's designed for some concrete takeaways. This is designed, we want you to leave here today after you've logged on and taken 35 to 45 minutes out of your day. We want you to feel like you're leaving with something and feeling like you can in your life have a step forward, whether it would be a focus on you, or it would be your nephew or your son or your mom. We hope that the information that we share today will be helpful and very concrete. Know that I'm going to share some thoughts. I'm going to bounce it over to my colleague Sue, who is going to share some just amazing thoughts and on the physicality of trauma and lead us through an exercise as well. And then perhaps we may open it up to questions. We'll see kind of how it flows. So that is kind of our overall process. So in terms of trauma, one of the things I like to think about relative to the overall concept is for all of us to kind of take a deep breath, and for all of us to sort of think about how difficult experiences, I'm not even going to use the word trauma yet. Let's just use the word difficult experiences, challenges. What was that like in the house that you grew up in? So in the house that you grew up in that culture and in that world, whether you were in the Ridgewood area or you were in the Midwest or on the West Coast or some other part of the world, what was it like in your house when something really difficult happened? And so we know that different families have different styles. I know, for example, I'll use my own family. I'm half culturally Italian Catholic, and I'm half, my mother was a little more, came over on the Mayflower, New England. And so half my family, I like to say, from a cultural point of view, was very excitable, and that was culturally normal, right? So for that culture, there was a kind of a loudness to it and an excitement to it and an energy. Whereas on the other side of my family, there was kind of a calm, at times too calm, one would argue, but a calm sort of process. What was your house like? Was there cultural implications? Were crises viewed as, oh wow, the world is falling apart, the ceiling is falling in, this is terrible? Or was there a moment of reflection, a moment of pause, a moment of thinking through, okay, what's next? This is really hard what we're going through as a family and what you may individually be going through. How can we work together to work this through? What can we do together to think about that? And the reason I like folks and all of us to reflect on that is because that teeing up, that early life, it really illustrated to us what we should feel and think, or at least how our families experienced what we thought and felt when things got difficult. And so no surprise that if you grew up in a house where there was a lot of excitement and a lot of sort of high level of emotionality, perhaps even a little bit scary, perhaps even a little bit uncomfortable, it may not then be a surprise that when you're 35 years old and experience some type of difficulty in your life, or 45 or 55 or 75, and some kind of trauma happens, that you have this immediate visceral reaction, whoa, and you go from 0 to 60 or 70 or 80 very, very quickly. There isn't a lot that I want you to do with that information, other than we certainly believe in our field that awareness is power, and awareness gives us more control. So if you have a better understanding of where your own reactions came from, you're going to have a more successful time in kind of managing traumas, managing difficulties. Similarly, there's all of us, right? We came along, we grew up, we went along, and maybe for some of you that partnered in life, maybe you're married, maybe you just live together, maybe you're not, but for families that came together under one roof during coupling, now suddenly we have two family experiences, two different family experiences. In other words, was your family kind of calm, cool, and collective, and your partner in life were their family kind of high strung and really revved up? And how do you make sense of that then as a couple? How do you make sense of that as a couple as you kind of come together? So again, awareness, thoughtfulness, just being able to sort of know kind of where you are and what you're about. One of the things we want to think about in terms of identifying whether something is a trauma or just a stressor, and I'm not one that gets too worried about language. I'm not overly worried about defining an event or something as a trauma versus something that might be a stressful event, or something that might be difficult, or something that might be challenging, because I'm not sure that differentiation or delineation is helpful. I worry that sometimes there's a little bit of judgment attached to it. So I worry that sometimes if we overuse certain words, there may be kind of a self-messaging that happens where we sort of just judge ourselves. And so think of this talk absolutely about trauma. Think of it also more broadly as difficult times in life, challenges, hard experiences, because that I guarantee you that if we were in a room, do we yearn for the days we were all sat in a room? If we were in a room and we passed out pieces of paper and a pen, and we said to you, can you write down the 2 or 3 hardest experiences in your life? What would they be? My guess is that you would be able to do that quickly, that you would immediately bring that up. It's very unlikely that you would sort of sit there and go, geez, I'm not sure, I don't really know. My guess is it would be an early experience, might be the death in a family member, a death of a parent, perhaps the death of a significant other or a partner, a divorce, just a difficult family situation. My guess is that all of us have that list of 2 or 3, and in all honesty, some people have a longer list than others. But all of us have certainly a list of the things that not only were challenging and hard, but also were then meaningful and had absolute input into who we became as human beings. So bring those together, I think it's really okay and a really great step forward to call them out for what they are. These were really hard experiences. Maybe they were traumatic, maybe they were just hard experiences, but these were really, really, in some ways, these were formative, right? These experiences, and I'm guarantee you that you can bring it up, that I could sort of say to you, do you remember a really hard time in your life? And you may bring to mind, again, a death or something like that, and then bring to mind all the details around that. And that could be really hard. And the reason, and that, by the way, sometimes happens over years. And if that happens unexpectedly, you may be having some flashbacking, you may be having some times where things come up for you in an unexpected and hard way. And flashbacks which are tied to trauma, for those of us that have been through traumatic events, if you have those things that sort of those tapes play, and they play unexpectedly, they may play because of a certain song that hits it when you hit the radio. They may actually often hit 2 other things. It's really the senses, light. And so we think about anniversary time, for example, around grieving and death. We spend a lot of time working with folks about the first year but that 1-year anniversary is really hard. And one of the reasons the 1-year anniversary is really hard is because there's so many other triggers that go on that trigger you that you don't remember. The color of the light during that time of year, the angle for which the sun hit, were the birds singing or were the birds not singing? Was it spring or was it winter? And so there's all these kind of things that trigger. And if you then start to play out these things in your head, where you play that tape over and over and over again, you are experiencing perhaps a trauma. You are certainly experiencing a stressful event. And in some ways, I'm here to tell you that replay is not a bad thing, because unto itself, if you're playing that over and over and over again, there's a little more control that you're yearning. There's a little more control that you're feeling each time you play that, particularly if your life has forged ahead, if your life is, relatively speaking, okay. So although I went through that trauma 2 or 3 years ago, I realize today that the trauma hit me, and perhaps you're then reflecting on the fact that, well, interesting though, I'm at work, I'm working, I have a fairly healthy relationship, I have a good connection with friends or family members, I actually get out there and enjoy my life, then, you're doing okay, even if we start to have this kind of flashbacky experience. Other times, it can kick up a notch. So sometimes we see things like agitation, where you're not able to really calm down, where you are not able to calm yourself down. And we all have kind of self-soothing techniques that we use, whether we're aware of them or not. Believe me, we all have self-soothing techniques. And we're going to spend a little time later on in the session with Sue going through some of that. But if you think about breathing, if you think about certain music, if you think about what works for you, by the way, real cue here, what works for you to self-soothe? Everyone has their list, and spending a little bit of time taking that breath and really thinking about what works for me when I get myself agitated. Is it certain music? Is it a hot Sunday? Is it a walk in the park? Is it what works for you in terms of that? If your usual soothing techniques are not working, 10 is up. I may be interested in thinking about a little further counseling or a little further treatment, but unto itself, flashback, agitation, you're able to self-soothe, I'm doing okay. Then I'm not overly worried about you. In my mind, it feels like you've mastered this. You've gone through a very difficult time, no doubt, but you're moving forward, one foot in front of the other. We say to clients at Bergen Mental Health Care, baby steps all together make a life, one after another after another. And so that kind of thing. Do you have physical responses? And I know that sometimes people experience it in their stomach or their chest. People generally experience anxiety and trauma physically somewhere in their body. And we ask clients to actually take a breath and think about, how do you experience this? Do you feel tightness across your chest? Are you a stomach person? Do you feel achiness or tightness in your shoulders and in your back? What is it for you? Again, that bringing things to awareness, that ability to kind of step up and think about that. Other things, sadness, depression, those things that kind of really drag us down. Those are things to certainly think about. In the long term, we do and are mindful and want to be thoughtful around nightmares. So sometimes folks that experience trauma and significant stress do have nightmares, and we're going to want to be mindful of that. And again, I realize that I'm giving you quite a list, and it's not one thing unto themselves. It's really kind of the big picture. It's flashbacks at the red light, plus some nightmare, plus my inability to soothe. That together may suggest that you would benefit from some extra counseling or for some extra help. But it's really kind of the big picture. So don't panic if you're doing okay, but every once in a while you have a nightmare. You're really okay. You're really doing fine. It's really the combination. It's almost like a recipe. It's sort of the first issue plus the second plus the third plus the fourth. That together can mean something. Memories, so going over it over and over and over again. And I also like to ask folks to really pause for a moment and give a guesstimate to me about what percentage of the brain does this experience take up for you. So is this difficult experience, this trauma, this hard time that you went through, does this take up 10% of your brain? Does this take up 50% of your brain or 70% of your brain? I say particularly to teenagers, how much real estate are we talking? What's it taking up in terms of your mind, in terms of your really, it's your mind and heart, right? But in this example, I'm really asking folks to articulate a number. And that gets people to reflect on how big a deal it is. So how big an experience was this? How big an experience is this today? And so if you're thinking that it's 30, 40, 50, 60% of my brain is taken up with this, and I think about it every day, and it's really hard for me, then we have a really honest and open conversation about what number do you want that to be? So if this trauma is taking up 50% of your brain, what's our goal here, guys, together? What's our goal? Is it 20%, 25%? What's the number? And so it also allows people to sort of build those skills of self-assessment. So building those skills of really being able to be aware in terms of what are doing. Last thing to think about before we talk about a couple of to-do items in terms of what you can do about it is, do you change your behavior at all? So start to ask yourself some really honest questions. So do you avoid situations or places because those memories come up? Do you go around the block? And I'm going to use a really concrete example here. Bad car accident that you had perhaps 2 years ago. It was at the intersection of, I don't know, Route 17 and Linwood Ave. And it was a nasty accident. You had a physical reaction. You went to an emergency room. You were in the hospital. Really, really, really difficult. Do you avoid, for these 2 years, the intersection of Linwood Ave and Route 17? Do you go up to Ridgewood Ave or get off on another street because the flashbacking that we talked about earlier, or that tape playing is just too much for you, where it just feels like it's a little much? That's situational. People, are there people that you find yourself avoiding because things come up for you? Often traumatic events, by the way, can be relationally driven. And so there can be violence, there can be all kinds of other things. And so is there a person, a family, a segment of the family that you find yourself avoiding because you want to distance yourself or keep yourself away from that person? Again, like with the earlier ones, that unto itself is really a very healthy and adaptive coping mechanism. It's really okay for you not to it's not the end of the world if you work at Valley Hospital and you have to get off on Ridgewood Ave and go around the block. It's really not the end of the world. And so we think about with clients, if you're avoidant and you're avoiding going certain places or doing certain things, then we need to pause together and say, is that really a problem? Or can you just schedule an extra 3.5 minutes in your day because you get off on another exit? You know, in our field, we have kind of this I think, a little bit of history of making everything into a thing. and sometimes people have adapted and coped really well, and they've built this coping mechanism. And our job is actually to reinforce that coping mechanism, not to break it down. And so that's an example. But if you're having a hard time and in relationship, holidays are coming and you're avoiding the holidays altogether, and that's impacting perhaps on your social life, maybe your partner in life is upset because they really want to go see your aunt and uncle and your cousins, or they want to visit their family. If we're starting to have other issues, relationally driven or otherwise, where our coping mechanisms or those things that you're avoiding are starting to get in your way, then we want to have a conversation. Then we want to think about coming in. We want to think about spending some time with a counselor or a therapist and working through those and processing through those. I would like to be really clear that working through trauma and traumatic events does not in any way, shape, or form make them go away. And so when folks come in for therapy and folks come into counseling at West Bergen Mental Health Care or anywhere else, the goal is not to extinguish it per se. It's not going to go away. Our goal, like anything else in life, is to figure out a way to live with it and figure out a way to better understand it, and maybe even to grow a bit from it, maybe even to really lean into it and figure out, why was this hard for me and how can I work this, how can I work around? You have really good skills. And so anyone that has been through a trauma, I'm here to tell you, you already have really good skills. Our job as clinicians is to fine tune those skills and get them to connect and get them for you to be more aware that you have the skills so that you feel more in control and so that you just feel better in life. And so here we are. We've sort of identified some of the things that that trauma can do. We've identified it in our body. We've identified it in our mind. Percentage of space it's taking up. Let's say that now we've concluded wholly that we have a traumatic event that's in our life, and that's part of our narrative and just part of who we are. So the proverbial now what? Where do we go? What do we do with that? And so a couple of really concrete suggestions here. First, think about who's close to you in your life. It might be a close friend, it might be a sibling, it might be a parent, it could just be a neighbor. But who are those folks that you feel safest with? And I personally would have a client actually make a list of those. So we're looking for a couple of people that you feel safe with and comfortable with. And we're looking for you to kind of check in with them. I would be interested in their perspective of you. And so in other words, do they see you as kind of high strung and stressed out and you're really struggling? Sometimes we're good at assessing ourselves. I'm here to tell you, sometimes we're not. Sometimes we're so caught in our own stuff that we don't always kind of see. So do you have a close friend that you can go to and say, you know, I've been struggling for the last couple of years. I had this event occur. I've been struggling. Do you see it impacting on my life at all? And my guess is if they are close to you, they would have, and they love you and they feel connected to you, my guess is they would have a lot to say about that. If it's in your way, and they may point things out to you that may be a little bit hard to hear. It's why we want to do it with someone that we feel safe and comfortable and close with. But they may point out to you some things that make it difficult to hear. Oh yeah, you remember, Michael, you kind of flipped out at the red light. Do you remember when someone ran through the red light? We were driving to the concert and someone kind of pulled in front of you and you really kind of lost it. And I would think, oh, geez, I didn't think about that. You know, sometimes it takes the people around us to kind of point out to us that we may be a little bit out of the middle lane, that we may be a little bit off. We're looking for you to then start to share those thoughts and feelings with those folks, should they feel comfortable. And I know this can be hard. Even talking about some events can be really difficult. But finding that small group that you feel close with, that you can share experiences with, will enable you to feel safer, because ultimately trauma is driven by a number of things. One of the things it's driven by, though, is a feeling of not being safe, a feeling of, even when you're out of the actual event, by a day, a week, a year, 10 years, do you still have that fight or flight feeling? Do you still have that fear that goes on in you? And so talking about it with a small select group of folks where you can actually share your thoughts and feelings may imprint on you that life is really going okay. And that you are going to be okay, that you are safe. That's really what we're trying to accomplish here. Couple of things, another takeaway we're really trying to get you to avoid. Try to get you to avoid alcohol during these times. That's not a great coping mechanism, although that happens very often. Also other marijuana and other things that are now readily available and legal. And so we find that sometimes folks self-medicate. And so sometimes folks are challenged with their thoughts and feelings. And so they're using other things, alcohol and other substances. You want to be aware of that. So you want to, A, try to avoid that. B, you want to be aware of it. So if you suddenly realize that the time of year where your event happened is coming, and you somehow realize that, oh, that's really interesting. It's now getting to be spring, and I find myself going home and I'm finding the second and third glass of wine is starting to pour. And so not only do we want you to sort of back off on that a little bit to think about some other adaptive ways, but we want you to use that as an indicator that, oh, okay, there may be something going on here. There may be something in a non-judgmental way. How could I kind of work on that? Another takeaway: structure and predictability. So fear and trauma have us feelings of the world being out of control and our world being out of control. So the best that you can structure yourself in terms of even your schedule. Schedules, believe it or not, breed structure, and structure breeds safety. It makes me feel like the world is predictable and like I'm okay. Exactly the opposite of what someone that has trauma-induced feelings is feeling. So we want to work on that. So schedules, obviously everyone to each his own, but in terms of the day schedule, the evening schedule, whatever would make you feel safe and more secure. We're going to ask you to lean in and try to accept support. So that comfortable and close person that you spend some time with to hear about what impacted on you. we're going to be asking you to lean in and really accept their kind words, accept their support. Sometimes folks that go through trauma have an experience where they have gone through the trauma and the experience of the trauma so alone, so by themselves. And there are lots of reasons people do things by themselves. There may be family reasons. There may just be your personality. I can handle this. I got this. I'm good. But you're kind of on your own. It reinforces an aloneness, and it reinforces where I can and need, keyword need to handle this on my own. And that's a message that we want to undo for you. That's one that we want to challenge for you. You do not need to do this alone. You do not need to be alone in this. And so whether we have friends or a partner or family or a clergy person or a therapist, whatever that works for you, we want you to lean in and try to open up to a point where you can think about letting their support in and letting really their love in, and their thoughts and their feelings and just their support overall. As I start to wrap my section, I'm interested in you thinking about whether, having gone through this experience and having gone through this little self-assessment that we've been doing for about a half hour now, do you feel like therapy and counseling might be helpful? And if you do, I would ask you to reach out. And so when we're reaching out for a therapist, we're going to be asking, again, going back to those close friends, do you know of a good therapist in the area? Do you know someone that has a good reputation? You want to be checking in maybe with your primary care physician, always a good opportunity, or pediatrician if it's child-based. They always have a wonderful network of therapists in the area that they've worked with, and that absolutely work with that. You want to be a little bit sensitive. We want to make sure when you call that therapist that they have some background in trauma, that they have some background in that. There's lots of credentials and lots of initials. We're a field that loves our initials behind our name and all kinds of things. We're really looking for someone to authentically and genuinely look at you and say, I can handle this. I know how to do this. I've done this before. Join me in this process, and I can keep you safe as we go through this process, and we can work together. Know that therapy can be hard, but immensely freeing in terms of that trauma holding you back and kind of closing you in. And so thinking about that as well. So with that, I'm going to hand it over to my absolute friend and colleague, Sue, who's going to take us through a couple of things.
Okay, thank you so much, Michael. That was really, it's interesting, it's informative, such important information, you know, and in lieu of what we've gone through over the last 3 years in terms of COVID, talk about trauma. And, you know, I think one of the biggest takeaways and one of the most important things is we've got to be very careful about judging ourselves and others, because there are people that went through COVID and they were introverts and thought it was a pretty good time.
That's right. That's
like, what's
very
wrong
true.
with me? And then there's other people who were like, this was really hard. You know, I especially the time of year. I remember a year after COVID occurred, and it was the warm springtime. And I went into like King's, and it was like, oh my gosh, I remember a year ago right now walking in here and there was no toilet paper, and it was really scary, you know. So I think that, you know, we don't want to judge ourselves, and everyone reacts to things very differently. Having said that, and I do agree, I mean, it's so wonderful that there's a lot of wonderful clinicians and therapists that know how to treat this very common issue. You are so not alone, and there is a lot of treatment, and I think it's important to seek out help. And it's just as important to, like Michael was saying, have some coping skills. Have some tools in your toolbox, stress toolbox, you know, and that's what I'm going to share a little bit about today. We talked about, you know, trauma, it often lives in our bodies. You know, I can remember even myself buying my first house, and I was so happy and so excited, and I thought everything was perfect. And a week after buying my house, and I was not moving things, my back went out. What? But that's where sometimes our bodies have that Achilles heel. And sometimes in your body, you know, some people might get sick and have heart palpitations, or they'll feel they can't breathe as well, or they'll have bone pain. So just be aware of that. So much of this is just getting to know ourselves and not judging ourselves, right? So yes, absolutely, trauma can live in our bodies. And I think that in relation to that, it's great to talk about trauma. There's so many, there's good treatments, but a lot of the treatments have to do with physicality, somatic treatments, right? Things like running water, we start to feel that panicky feeling. Michael was talking about all of a sudden you're sweating, your heart's palpitating, nothing's going on, but maybe you're in a locale that makes, that you experience problems, when you were there, or it's a time of year, whatever. Something as simple as opening the window. We're talking about that exit off of 17 and just changing the temperature, getting wind on your face. Some people, we talk about, what are those blankets called? There's these blankets now that are weighted, right?
Yeah, the weighted blankets.
Okay.
Yes, absolutely.
For some people, just wrapping themselves and feeling cocooned in a blanket can calm ourselves down, calm down our systems. Other times people will run into the bathroom when they start to feel really agitated and just, splash cold water on their face. Or this is crazy, but they'll take an ice cube and just, rub it along their neck or something. These temperature changes, these actions can actually, it slows down our heart rate, right? It can even reduce our blood pressure. It can kind of snap us out of it. That moonstruck, right? Snap out of it, but I say that very gingerly and gently. We do want to change what's going on in our systems. Change our sort of neurology a little bit, if you will. Other times, I'm going to give you a few different tips. Sometimes taking a run or a pace walk, that can really help a lot. We have the tendency to want to calm ourselves down. And with trauma, it's hard to do that sometimes by talking to ourselves. Sometimes you can talk with a trusted person or your therapist, but a lot of times we want to think ourselves out of it. That's not always the answer. So you get out and you hit the pavement. Take a fast-paced walk, something, dance, move. Sometimes yoga is wonderful for any kind of trauma. Absolutely. Something like a progressive, body relaxation. You probably heard about this, but even tensing some of your muscles, starting from your toes, right? You squish your toes together. You relax them. You do that to every single part of your body, from your toes up to your head. Something like that can be, again, it's moving the body. It's sending those responses to the brain from the body. Just even thinking about, considering breath work. And again, sometimes when you're so overwhelmed, your breathing comes too fast. But if you can do something like 4, 5, 6 breathing, something that's very concrete, where you breathe in slowly through your mouth to a count of 4. You hold for 5 seconds, all the time seeing these numbers, and slowly breathe out of your mouth to a count of 6. What we're doing is just seeing those numbers over and over again. We want to kind of, sort of distract ourselves to some degree. 4, 5, 6 breathing has been shown to be very, very powerful. Sometimes just playing a game with someone. It sounds really, for kids, we find this sometimes to sort of assist them to release some of that tension, is to, in a way, distract, yes, but maybe play a game, a categories game or something. We're talking about just kind of, connecting what's going on in our mind with our bodies, and it's a way to heal. Another great technique is sort of what I'm going to leave you with, which is a grounding technique. This is based out of mindfulness-based stress management, and really all mindfulness is just being in the present moment. And then when you think about trauma, maybe one of the thoughts is, I don't want to be in the present moment. I want to be anywhere here. However, if we can think about, we only have to deal with this moment, one moment at a time. We get through this, and then we'll get to the next moment. A way to really be present in the moment and to cope is to ground yourself using your 5 senses. Very effective. And again, this has been proven to reduce your blood pressure, slow down your heart rate. Everything just kind of evens out a little bit, neutralizes. So you think about, even right now, just notice 3 things. What are you seeing right in front of you? My face, the color of the computer, maybe something on the table. And then kind of think about, what are 3 things you hear right now? Maybe the hum of the computer, my voice, something that's a car that's passing outside. a couple things that maybe you can smell. Perhaps the smell of coffee, or, you know, the mustiness of a room. Maybe if you're outside, some flowers. Something that you've just tasted. You know, maybe you had coffee before, had some gum. Just notice what you're tasting right now. And finally, what are a couple things that you feel that you're touching? Your pants, maybe the metal on a chair, maybe your own fingers. So that took all of about 7 to 10 seconds, right? But it slows down everything. And it really helps us a lot in the moments we're really feeling overwhelmed. So again, change the temperature, run some water all over, you know, over your hands, some ice, get out and pace walk or run or move, distract yourself with a game or ground, or just breathe. And these are things that may really help you with this. And know you're not alone, and that so many people, they do get better. Absolutely. We're learning more and more about trauma and deep-seated anxiety, and every day there's more treatments. So absolutely. Well, thank you so much. We don't have any comments or questions right now.
We did have
However,
one question, and I answered it. There was one question, and I did
oh,
answer
good. Thank you.
right in the
Thank you, Michael.
yeah. Well done, Sue. I really appreciate your thoughts in terms of the body, the physicalness of us, and I particularly appreciate how you started, because thinking about having to do that or needing to splash some water or open the window, and then not judging ourselves for that, right? So thinking like, okay, this is just where I'm at right now. This is where I'm at, and I can actually do something about this. You're so right in terms of the connection between those two, the body and the issue at hand.
Absolutely. We have a nurse here that we have a nurse. I don't know if you guys know Diane. She'll always say, "So what? You know, so you have to use the wheelchair.
Love it.
So you have to get some counseling.
Love
and
it.
so you feel overwhelmed. So what? Let
Right.
that be your mantra." So many people are going through this right now. All those people you see on 17 with road rage or really irritable in the mall. Guess what? They may have anxiety and trauma. So we're
Very likely.
And be proud of yourself that you're actually recognizing and doing something about it, right? Because a lot of other people won't and haven't.
100%, Barbara.
Self-care and you know, be really proud of yourself for doing that.
It's so brave.
It is brave.
So brave. Even tuning in today, even learning about this stuff.
Very much.
So thank you so much, Michael and Barbara. It's, as always, wonderful to be with you. I thank you. And I thank you all for